Hello.
Dan kan ik achterkant staan. Maar ja, dat zien we dan allemaal wel. Ik hoor nog niks.
Hello. Moosgan, hello. Hi.
Nou, we gaan het wel zien. Wat vind je daarvan? Als het nou naar jou toe komen?
Morning.
Hello everybody.
Yeah.
Good afternoon.
Yeah.
Good afternoon.
Hello.
So
Sizi görüyorlar şu anda görüntü olarak.
we will wait for 5 minutes.
Görmesi sakıncası var mı?
Then start.
Hello. Ben küçük. Sesimizi kapatalım ama bence.
I think we will have maybe 1 hour, maybe a little bit more. We'll see of presentation.
Dear Dr. Marina, could you explain to everyone that what you will be sending them after the webinar? Because people were asking that whether they would receive the video or any presentation itself.
We don't send presentation. You can make your notes or print screens or anything you want, but we will make a record of this presentation and webinar. So you can find this video of webinar at our resources. And of course, if you need any additional information from this presentation, you can ask me and I will send you personally.
Yeah.
Okay, so I think we can start. If anybody will join us, our specialist will let them start as well. So my name is Dr. Marina. I'm dermatologist and medical advisor of Forlet brand for more than 10 years already. And today our topic is lymphodrainage system. Just a moment, I will close my screen. Okay, so today we will delve into a critically important aspect of our work, managing the lymphatic system and combating edema and puffiness on the faces. Understanding these processes is key to achieving lasting visible rejuvenation and improve the skin quality. Facial and body edema is one of the most frequent patient complaints in our practice. It visually ages, distorts features, and creates a feeling of fatigue and ill health generally. But behind this lies not only a cosmetic defect, but also a disruption of vital physiological processes, microcirculation and drainage globally, draining system of our body. And let's recall the basics. The lymphatic system is a network of vessels, nodes, and organs responsible for draining interstitial fluid, transporting immune cells, removing metabolic waste, toxins, excess proteins, and common fluid from our tissues. Unlike the circulatory system, lymphatic system has no pump, has no heart. Lymph movements relies on muscle contraction, breathing, arterial pulsation, and external influence, like our massage, for example, face massage and body massage. Therefore, a facial puffiness treatment protocol in a cosmetologist's office should include brief analysis of puffiness causes, body work, at minimum localized activation of lymph nodes to facilitate facial lymphatic drainage during MLD, manual lymfedrainage massage, home care recommendations for sure for puffiness reduction. So when our complaint is puffiness, is edema, it's not only our focus on the face. It's a global topic, global question. Causes are diverse, general and local. From general causes, it's heart, kidney, liver failure, endocrinopathies, venous insufficiency, inactivity, physical inactivity of our body, protein deficiency, certain medications, and allergies. And also we can differentiate local face and body causes like lymphostasis, venous stasis, inflammations, post-traumatic, post-operative acne, tissue hypoxia, impaired innervation, age-related decrease in lymphanian tone, excessive UV exposure, improper care, sleep, intoxication like alcohol, smoking. So it's important to differentiate the reasons of puffiness, of edema. The cosmetologist deals with local functional edema, usually having ruled out serious systemic pathology. The key mechanism of cosmetologically significant edema is lymphatic insufficiency. Under increased load, excess fluid, protein toxins, or reduced lymphatic vessels capacity, like hypotonia, fibrosis, the system fails. Protein-rich fluid accumulates in the interstitium, attracting more water, forming persistent firm edema. Collagen fibers sclerose, skin sickens, and we get fibrosis also. How we can differentiate the type of edema, the type of swellings. Lymphatic, lymphadematose edema is firm, slow, or absent pitting on pressure. Skin may have orange peel appearance, often asymmetric. Sorry, can you switch off the microphones, please?
Ben ayarlayamadım.
Colleagues, can you switch off your microphones, please? Thank you. Often asymmetric, starts distally from feet or hands. Venous edema, soft and doughy, pitting on pressure, worsens in the evening after exertion, often associated with varicose veins, leg heaviness, cyanosis. Inflammatory swellings, localized, warm, painful, and redness. Hypooncotic protein, soft, widespread in hypoproteinemia. The cosmetologist most often deals with functional lymphatic edema of the face, morning puffiness, pastiness, and local inflammatory edema after some medical procedures or aggressive treatments, injections, fillers, lasers, etc. The general principles of edema management. As I told, when we face with swellings, with complaints of our clients to puffiness, we never can treat only the face. We have to consider lifestyle and diet correction, systemic support, nutraceuticals, phytotherapy, medications if indicated by physicians, manual techniques, devices focused on lymphatic drainage, physiotherapy, core tools. We can use injectable techniques, mesotherapy with drainage cocktails, biorevitalization with peptides or certain drainage ingredients, but not with hyaluronic acid. We have to avoid big concentrations of hyaluronic acid when we face with edema, and professional and home care consolidating results. Without lifestyle correction, without home care recommendations, procedure effect will be temporary. So our recommendations for the clients with puffiness will be well known by the specialists, but we will repeat. So hydration is very important. At least 30 milliliters per kilo of pure water, evenly throughout the day. Limited coffee and strong tea, of course, alcohol, strong diuretics and dehydrators. Limit of salt to 3 to 5 grams per day. Watch hidden salt in the products, sauces, cheeses, sausages, fast food, etc. We have to watch proteins, adequate intake from 1 to 1.5 grams per kilo to maintain oncotic pressure. Potassium and magnesium, focus on green vegetables, fruits, nuts. Detoxification, reduce sugar, refined foods, preservatives. We remember also that sugar will destroy our collagen fibers in the skin and reduce microcirculation. We have to watch to the physical activity, regular walking, swimming, exercises, stimulating the muscle pump as it take part in lymphatic system. And posture, avoid prolonged sitting, standing, don't sit cross-legged. So we have to talk about it with our clients as well, with about lifestyle correction, not only local treatments for the face. So on this slide, you can see systemic support, nutraceuticals, and filler preparations, the botanical support of lymphatic system and lymphatic drainage, which we can recommend to our clients. Of course, we remind patients to consult with their physician, but globally, it's safe ingredients. So to enhance drainage and strengthen vessel walls, we can recommend venotonics, angioprotectors like diosmin, hesperidine, Detralex, Flibodia, troxyrutin, Plant diuretics, mild plant diuretics like lingonberry leaf, bearberry, horsetail, green tea, extracts, antioxidants, vitamin C, routine capillary strengthening, coenzyme Q10, specific complexes. Gotu-kola, Centella asiatica improves microcirculation and collagen synthesis. Ginkgo biloba improves blood rheology and antioxidant. Grapeseed extract, potent angioprotector. And drainage complexes, often combinations of extracts, artichoke, dandelion, nettle, and fennel. And then the gold standard manual lymphatic drainage during our treatment, during our facial treatment, MLD. As lymphatic capillaries are very superficial and lymph is flowing very slowly under the skin. So it must be very gentle pressure, subcutaneous tissue, not muscles. So very superficial movements, rhythmic and slow movements, direction strictly along lymph flow from distal to proximal towards regional lymph nodes. Indications: functional edema, post-traumatic, post-operative edema, after surgeon's approval, lipedema, preparation for anticellulite programs, detox, heavy leg syndrome, and general fatigue. And contraindications: acute inflammation, infections, recent stroke, malignancy, thrombophlebitis, decompensated CVD, kidney diseases. This gold standard, this method was developed by Dr. Emil Wader. So it's often mentioned principle of Dr. Wader. You can meet with this in your practice. So manual lymphatic drainage, MLD for the face, Wader technique fundamentals. So critical principles for effective facial MLD. Node preparation. For 5 minutes, we clear supraclavicular, submandibular nodes using stationary circles to open the drain. We cannot start massage of the face with swellings, with puffiness, without starting from node preparation. Directionality rule: always move toward nodes. Forehead, temples, nose to ears, from chin to jawline. We have to control our pressure. Feather light touch, stretching skin to 1 or 2 millimeters only to avoid capillary rupture. And we use pump technique, stationary circles at lymph water shields, glabella, filtrum, and mental crease. Never treat congested areas before proximal pathways. Just a moment, I will check the question. Is this the same technique as face yoga? Really, I don't know the technique of face yoga. I really against any face exercises because usually with aging, we have to relax our mimic muscles on the face and not to train them. But really, unfortunately, I don't know the principle of face yoga. Maybe I will check. And we have to remember this, that neck and décolleté are critical drainage pathways. So when we start treatment of face with puffiness, with edema, we have to focus also on these zones. And key landmarks on these areas, supraclavicular nodes. We can treat them with stationary circles, about 30 seconds per node. Next level, jugular chain, effleurage along SCM border. Next level, transverse cervical chain, horizontal strokes above clavicle, and technique. First phase, we clear supraclavicular nodes. Colleagues, please switch off your microphones who didn't do it yet. The next phase, we drain sternum, clavicles, decongest thymic area. And the next phase, posterior drainage, neutral reach to trapezius in section.
Sorry, can I ask a question?
Yes, sure.
Hey, hello, how are you today? Going back to the motions that we need to do and the pressure we have to apply, right, for the lymphatic drainage massage. I know it's very describatory, as you would explain it like this. Is there any way you can show a video about this, to really show how much pressure we should apply? For example, is there anything available for this?
It's a very good question, because at the moment we don't have any specific video for that, but I know that it will be very useful. So I think we can prepare the quick video, and I will show you the most important principles, how to treat edema, because it's not only about the face. I will show you how I will explain you during the presentation, but in the video I think I will do in the nearest future, and I will show you how to press, how to put your hands, how to press the legs, and etc. So thank you for your question. I will.
Amazing, thank you.
I will do it. Mm-hmm.
Thank you.
Okay, so this one. What else we can do to combat swellings? Device selection matrix, matching tech to pathology. Devices which usually we use to reduce swellings and edema. Pressure therapy, of course. Usually it's body treatment, not for the face, mostly for the legs, with following parameters. Usually we treat postoperative body edema and contraindications, DVT, deep vein thrombosis, and congestive heart failure. Pressor therapy creates mechanical pressure on tissues and blood vessels. So if we have a client with DVT or CHF, DVT has a high risk of thrombosis rupture. It squeezes fluid from the intercellular spaces into the circulatory system. And with congestive heart failure, this provokes an overload of the heart. So patients with this pathologies are shown only manual lymphatic drainage, MLD, which caution or without compression of problem area. Next very often device which we use to combat swellings, microcurrent, the most popular and one of the most effective. With the following parameters, we can treat morning facial pastiness, contraindications, metal implants. We can use radiofrequency with bipolar mode to treat fibrotic edema. Contraindications will be rosacea and fillers, and fragile capillaries and copperosis, of course, when we have problems with superficial capillaries. LPG and dermatological treatments for the face and body, which we use when we have cellulite-related edema and contraindication open wounds. And ultrasound is a rare device, but we also can use ultrasound for deep tissue edema with drainage cocktails. And contraindications will be malignancy history. And even if we use devices, even if we use technologies, we always combine these treatments with MLD, with manual techniques first, because we remember that to treat local edema, we have to open our lymphatic system globally. So we have to improve veins outflow, we have to open lymphatic nodes, etc. So manual treatment is obligatory. So this is the programs which we can use with our devices which are available in the cabins. Microcurrent, radio frequency. If you need this parameters, I can send it to you. So we will not spend the time to read this in details. Usually, we're working with devices for 10 minutes, and prior we do manual lymphodrainage also for 10 minutes. And injections, injection techniques, methatherapy, drainage cocktails, which we also can use to reduce edema. First formula with mild edema, we can use L-carnitine, caffeine, and artichoke extract. For fibrotic edema, we can use aestin, bromelain, and pentoxifylline. Injection protocol, we can use needles or cannula, depending on the zone which we treat. Density, about 0.5 centimeters. Volume from 0.8 to 1.2 milliliters per hemiphase. And we can use not only mesotherapy for the face, but it's very popular treatment when we do vascular stage protocol, body lymphatic oriented mesotherapy. Just a moment, I see the question. Can we accept some other guests in the waiting room? Yes, just a moment. I will ask our technical specialist. Just a moment. Mm-hmm. Людей там пусти. Ну, спасибо. Sorry. In my practice, it's the most often protocol which I use to combat edema, not only face but global as well. I use the formula which you see on the slide: L-carnitine, caffeine, artichoke extract, roxyrutin, ginkgo biloba, and sweet clover. Injection protocol. This technique using nappage method along paravertebral zones on the back.
Dr. Marina, there is always some other people waiting in the waiting room.
Yes, Kostya. Yes, I asked already. Just a
Kostya,
moment. Yes, Kostya will let them.
There is another one.
Mm-hmm. So linear nappage, several punctures with needle 31G, 4 millimeters are enough. It's very superficial technique. Direction always from distal to proximal flow, like from sacrum to cervical spine, ankles, popliteal fossa. First, I treat paravertebral zone, then arms, linear threads from olecranon to axilla, and then legs from Achilles also to popliteal fossa to the hips. About 5 milliliters of the cocktails totally I use for this technique. And the course is 4 treatments once a week. Especially after holidays, after New Year, etc., when we have swellings connected with alcohol, toxins, etc. So now we can consider methods and products by Follett, which can help to reduce puffiness during the treatment. As I told, and as you know, we don't have a magic pill to reduce edema and puffiness on the face, but we can significantly improve the situation, remembering the principles mentioned above. The procedure for a person with puffiness does not begin with the face. We remember that we have to start from other zones to switch on our systems. So how to start the treatment of swellings, how to start the treatment with the faces with edema. The first thing I do in my practice is I go through slow pressing movements along the legs, from the feet to the hips, just using my body weight. It must be very rhythmical, slow movements, about 5 minutes to activate the general lymph flow of the body. This doesn't have to be done on bare legs. You can do this press therapy directly through a towel or blanket. You don't have to do it on the skin. Then I massage the back of the neck and trapezium to activate venous outflow from the head and face. Also about 5 minutes, I do intensive massage of these zones. And only after that you can proceed the standard facial treatments. And the lymph nodes of the front surface of the neck, décolleté, and face will be activated already during the massage at the certain stage of treatment. Yes, of course, about the video I will do, and of course I will send you this video, or we will just open access to our internet resources where you can see our marketing materials. So first step, legs. Second step, back, neck, back of the neck and trapezium to activate venous outflow from the head and face, and then only we can start with the face. It's you're confident with these steps. It's our cleansing system, and this ritual, these products also can help us to start the process of microcirculation improvement and lymphodrainage. First, this product does not contain big concentration of hyaluronic acid, so they will not accumulate water in the skin. As you remember, first we massage the face with clearance cleansing. We also can focus our attention on their zones with our lymphatic nodes. And repurance wash, when we do the foam with this product, we use our fan-shaped brushes, which also additionally stimulates microcirculation and oxygenation of the skin. Provides healing and refreshing effects, but not only. Lymphatic drainage effect will be also provided with this massage. It's very superficial, very slow. We distribute these bubbles on the face like a champagne effect on our skin, which is stimulating microcirculation. And stimulation of microcirculation, stimulation of this process is one of the most important factors which help to drain the tissues, to drain the skin. So don't skip this massage with brushes. It's the start of drainage. Then the products which we can use for lymphatic drainage in our treatments. First, our oxygenic masks, oxygenic gel pack together with essence powder and sparkling gel pack. These two masks with carboxytherapy effect will improve microcirculation significantly on our skin, and we can improve not only microcirculation, but also all metabolic processes in the skin, including lymphatic system as well. Just to remind you, carboxytherapy effect. This treatment causes a phenomenon known as short-term controlled skin hypercapnia that stimulates hyperoxygenation. We apply the mask which produce CO2 gas during the exposition on the skin, and we create a mild stress for our cells, for our tissues, with lack of oxygen. And after we remove the mask from the face, our tissues and our cells start to accumulate oxygen from all possible sources. So that is how we improve metabolic processes, oxygenation, hyperoxygenation, microcirculation, and all skin tissues processes. This mask visibly improves the face contour and will leave your skin refreshed and visibly rejuvenated. And also we use oxygenic treatments for detoxification. So we also evaluate the toxins from the skin and tissues. Oxygenic mask we prepare from the gel and essence powder. We mix them together in the bowl and apply to the face for 15 minutes. And sparkling gel pack, the same effect of carboxytherapy, but also we can recommend this mask to the clients for home use, especially for clients with sagging, dull skin, for skin with swellings, to support our treatment, which we can do in the cabin. Colleagues, please switch off your microphones. I can hear you. Girls, please switch off your microphones. I can hear you. Okay, the next principle we can use to reduce edema, reduce swellings, when we use products creating occlusion on the face. In our range of products, it's our platinum mask, the plaster one, which create occlusion on the face, and also patches for the eyes. These two products, which also can help us with edema. All platinum products will be good for treatments of faces with puffiness, as platinum line doesn't contain big concentration, high concentration of hyaluronic acid first. It contains more platinum powder, and also platinum line contains the ingredients which provides detoxification. So it also helps us with edema combating. On this slide, you can see the features that this mask can be combined with Reliance gel and can be applied after injectable procedures. For the swellings, we does not use the mask with Reliance gel, and we have to avoid the product with high concentration of hyaluronic acid as Reliance gel. We just skip Reliance gel and use this mask as it is. We can apply it to the clean skin, we can apply it to the lotion or to the serums. Next mask, also detoxifying and reducing swellings, reducing puffiness. Unusual for you, is this mask still available? Yes, if it's not available immediately, it will be available soon, because we will still produce this mask, but mostly we will position it for home use. Yes, it will be available. If you don't have on your stocks, soon you will get. Next mask is deep purifying mask. It's a film mask which also will provide detoxification and combat edema. So when you do cleansing programs, detoxifying programs with deep purifying mask, you will also reduce swellings on the face. Of course, taking into consideration the principles and methods which we discussed before. And our royal product against swellings, designed specially for this issue, especially for this problem, is Royal Clay Pack. The mask for face oval modeling with triple clay blend, Gasul Moroccan lava clay, bentonite and phonolite. This mask globally improves the blood circulation and rheology in our tissues, provides pronounced drainage effect, helps to relieve swellings and puffiness, provides powerful detoxification, ridding the skin of pollutants, toxins, and excess sebum, increases capillary resistance, tightening the skin, shrinking of pores, soothes the skin and relieves irritation at the same time, has relaxing effect, relieves tension and spasms of our mimic muscles on the face. Indications: deformational edematous type of aging, ptosis, gray complexion, puffiness, dense heavy skin, enlarged pores. This mask is absolutely suitable for sensitive skin, even for hypersensitive skin. In comparison with usual clay mask, it doesn't give hyperemia on the skin and provides instant modeling effect and anti-swelling effect immediately after single use. So how to use this mask? First rule, during their exposition, during 15 minutes while the mask is on the face, it must be wet. So you must apply thick layer of the mask. If it's dry out on some zones, we just wet this with water, with your fingers. You can make massage on this mask with wet hands. During the exposition, during 15 minutes, you can do massage with this mask. Also, it will give incredible effect. Or you can use this mask if you want to improve modeling effect of the mask. You can use gauze bandage. You just put thick layer of the mask and you are modeling the face with the gauze bandage. And also watch to mask to stay wet, not dry out during 15 minutes. Because if it will be dry out on the face, it will just work as absorbing mask. It will not give this improvement of blood circulation and rheology. It will not provide such visible drainage effect. And eye care products, reducing also swellings on the eyes. First and best for swellings is P-Effect sheets, P-Effect patches, and Hyology Eye Moist Lift. The serum designed specially for the periorbital, for the eyes area, also contains ingredients reducing swellings around the eyes. So P-Effect sheets, P-Effect eye mask provide us instant lifting and firming, immediate rejuvenating effect. Also, if our problems are swellings under the eyes, we don't use Reliance gel. We put P-Effect patches as it is on the clean skin. But you can combine it with serums. You can put serums under the mask. So it will reduce wrinkles and fine lines, provide drainage and detoxification due to occlusion which it gives. And eye moist lift, eye essence for instant hydration and lifting. Also the products with drainage effect. It provides a complex skincare around the eyes, not only combating swellings, but also, of course, reducing wrinkles. We use this serum also after surgical operation for the eyes. It gives instant rehabilitation, instant recovery after blepharoplasty, after lasers or after surgical one. Reducing dark circles around the eyes and relaxing hyperactive mimic muscles around the eyes. And which treatments we can use for girls? Please switch off your microphones.
The microphones niet van uit. Nou, ik doe deze nu uit.
Because I can hear your voices, please. So which treatments we can choose from our treatment book when we combat swellings, when we combat edema? First one, the best one, facial contour remodeling using the Royal Clay Pack. This is the treatment, first treatment of your choice. Then carboxytherapy with oxygenic gel pack and essence powder. We can use intense 3D facelift with lifting mask, but there are products in intense 3D facelift treatment. We don't use products with high concentration of hyaluronic acid, so also it will help to provide drainage effect. And what other recommendations we can give when designing the treatments for people with puffiness, with edema? First, we reduce the use of products with high concentration of hyaluronic acid, with P-effect complex, with low molecular hyaluronic acid, which creates hydrodepot in the dermis. Especially if the procedure, if the treatment is performed in the evening. And we change the refining lotion, for example, to platinum or redify or peeling lotion, because you remember that refining lotion is a lotion with the most concentrated hyaluronic acid. We can change the P-effect essence or HA100 serum to the less moisturizing ones, to the peptide serums, to the platinum, placental serums with vitamin C, eggshell membrane, etc., with a less concentration of hyaluronic acid. Observe the amount of applied products. Do not overload the skin. Use the recommended quantity and use lighter creams on the final stage, or reduce the amount of cream applied in comparison with your usual quantity. And next treatment, which you can use, sparkling platinum, the treatment with sparkling gel pack. Deep cleansing treatment for clients of all ages also will help to reduce swellings, and rejuvenation and lifting treatment also suitable for the faces with swellings. Just to clarify, I will have a question. Just to clarify, for royal clay pack, we will massage it onto the skin, not the other technique where we apply gauze and apply it on top and leave for 10 minutes. We can use it as usually. We can just put the thick layer of the mask and leave it for 15 minutes. But if we want to improve lymphodrainage, we can do massage on this mask just with wet fingers, with wet hands, adding a little bit of water to make gliding easily on the skin. Or we can apply the mask and use gauze bandage. If you want to do massage and then to use a gauze bandage, you just have to add a little bit of mask after the massage, just to make a thick layer. Okay, so this is all information which I wanted to give. If you have any questions or you want me to give more details, please, I'm at your disposal at the moment. About video, I understand we will try to organize in the nearest time. Can you just, I will need your contact details regarding this video. Could you please write me your emails? So I will send when the video is ready. Thank you very much for your participation. I hope it was interesting. Yes. Thank you for your emails. I will send to everybody. Okay. Hope it was useful for you. So if any questions about the treatments or about their techniques fighting with edema, please. Okay, 1, 2, 3, 4. Okay, thank you very much. I was glad to see you. And thank you for your questions. It was interesting to communicate with you. Hope to see you offline, finally nearest time. And have a good day, have a good evening.
Thank you, Dr. Marina.
Thank you.